Yeah, hi Venus. Hope you're doing good. So now I am here to explain how to handle general pathology in the most simplest way. Okay. So always do make a note. Okay. So your seniors have done well, and the result was extraordinary. Okay. And they have given so much of positive vibes to all of you that anyone at any level, whether an intern from any sort of college, can end up with great ranks. So this was proven by so many of your seniors in the first attempt and few of them in the second attempt. Okay, so these are all like positive vibes, and these are ray of hopes for your preparation. So this general path, I'm going to start with this. Always keep in mind that this preparation or this year is going to be your best and last preparation. This is what the code I always give to every student. Okay, the only thing is you keep your work, you keep your best work for this year, by which you can make this as the best and the last preparation. So you no need to repeat the exam again and again to see betterment in your scores or in the marks. So taking ahead, of course, general path. I hope you remember your general path which you have done in the second BDS, and I hope like most of us have done general path in combination with microbiology. Okay, so because micro and general path together are one university paper for us during second year, and of course it is given least importance at that particular point. But here, as we go with an integrated preparation, okay, so as we always go with an integrated preparation, general path is always combined with oral path, is combined with oral medicine, is combined with general medicine, is combined with physiology in majority of the situations. So keeping all these subjects, these integrated subjects in mind, and of course most of your questions in the examination hall will move in and around these subjects. So keeping that in the mind, okay, I tried my best to segregate few important topics which are exclusively related to general pathology. So we are going to do these topics now, and whatever they are integrated with, whether it is with oral path, whether it's oral medicine, general medicine, or physio, we'll try to do when we encounter those respective subjects at that particular time. So first of all, you try to focus on my main contents. Okay, so try to focus on the conquer schedule and try to finish the tasks and the tasks or the goals that are given for a specific date on a specific time. Okay, I hope this is very clear. So this particular subject is going to get integrated with many other subjects. And coming to the just a glance over the blueprints of the NEET and as well as INI-CET, or whether you are preparing for any sort of license exam throughout the world. Okay, so there are basic empirical rules that you have to follow for this particular subject of general pathology. So coming to the NEET, okay, the gold standard examination for most of the aspirants in the country. If you take NEET has clearly given general pathology in combination with microbiology is going to carry 14 marks. So general pathology alone is going to carry 7 to 8 score. Of course, if it is being integrated to any of these 4 subjects, it can be increased, but general path exclusively is going to carry somewhere around 7 to 8 marks in NEET. And coming to INI-CET, so INI-CET, they are not following a particular blueprint. Okay, sometimes you see more repeats in INI-CET, sometimes you see less repeats in INI-CET, sometimes you see more questions from general pathology, sometimes you see limited questions related to general pathology, because in majority of the situations they'll try to integrate general path with other subjects. So considering all of these, I can code somewhere around 8 to 10 marks for general pathology in INI-CET. But mode of preparation of NEET or INI-CET or any sort of national or international license examinations is almost the same. Okay, means there will be questions coming from the core concepts of the subjects. And of course, if you take NEET, sometimes the repeats will be more, sometimes the repeats will be less, and same goes with INI-CET. Okay, reading a repeat is completely a different ideology. Okay, that which we are going to do in the second round or in the last phase, or the end part of each subject. Now we are planning to discuss and finish the repeats of, so that your scoring will be better in the final exam. But learning the core concepts is same for any sort of entrance or at any mode of your preparation. Whether you are reading the subject for the first time or second time or third time, core concepts are always, you should master the core concepts. So keeping core concepts in mind and keeping the strategy of integrated preparation of MDS CONQUER in mind, I try to list out few topics of general pathology which has to be done thoroughly in the upcoming 10 days. I cannot give more than a week or 10 days for general pathology because its scoring is 7 to 8 in NEET and hardly 8 to 10 marks in INICET. So we tried our best in providing the refined filtered content in the form of smart videos, in the form of smart notes, in the form of a number of topic specific and subject specific questions with proper explanations, and of course evening activities will be there, pro live classes will be there, offline classes will be there according to the plan which you have chosen. So we tried our best to provide you the refined content, and I want you to finish this refined content in the limited time and try to do n rounds of revision. So that's the main goal of the general path. Okay, so coming to general path, okay, a proper 7 to 8 days of preparation is required for this particular subject. Okay, sometimes we allocate like 10 odd days in the first round and probably 5 or 6 odd days in the second round. This is how we used to handle general path in round 1 and round 2, and these are the topics that you have to finish from general path at any cost, and we'll try our best to provide as much content as possible related to the general pathology in the form of smart videos and smart notes. So coming to the topics in detail discussion, coming to the cell adaptation, okay, so in which you have to learn top to bottom about reversible, irreversible injuries and all the 3 or 4 types of cell adaptations, your hypertrophy, hyperplasia, metaplasia. Hope you remember all of these which we have learned. Okay, so please do the cell adaptations and try to focus more on the examples and the differences between the different types of adaptation. Followed by cell injury, followed by cell necrosis. So your apoptosis, your necrosis, your different types of calcifications. Okay, all these which we have done at UG level has to be done thoroughly by following the smart video session. Then the second topic is the wound healing, okay, and wound healing or the tissue repair. Okay, so this is a topic where we encounter this topic in many subjects integratedly, like general surgery. The topic is there, oral surgery, where we will be focusing more on healing of an extracted socket. Okay, and in oral pathology also we talk about the healing, wound healing and everything. And of course this is again repeated in perio also, healing of flaps and all this, directly or indirectly. The mechanism is almost the same. Even in endodontical surgery, microsurgery of endo, we talk about this wound healing and everything and try to finish the basics of the wound healing and tissue repair here. Coming to acute and chronic inflammation, that is the mediators of acute inflammation, how it occurs, and followed by the chronic inflammation, because we have questions in recent NEET examination. 2 questions on chronic inflammation are there, okay, simple and direct questions, and followed by I want you to finish hemodynamic changes, what are the changes, physiology that occurs leading to edema. Okay, amyloidosis is very, very important topic. Gene numbers, okay, gene numbers and genetics and pedigree charts, okay, and mode of inheritance examples are very, very important. Autosomal dominant, autosomal recessive, X-linked recessive, X-linked dominant, and all these are very familiar questions. So they're going to give a disease and they're going to ask you what is the mode of inheritance of this particular disease. All of the following are autosomal dominant except one. Identify that one. So these examples are very, very important, and we tried our best to provide these examples with lots of mnemonics so that you can remember the memory based content in the most easiest way, and I'll try to provide you a special examination on the pedigree charts as well as the mode of inheritance so that you can exercise these memory based contents. Then goes with the neoplasm, okay, where you need to learn about the malignant, benign, oncogenes, respective genes or gene markers responsible for occurrence of a particular carcinoma or a particular disease, and all these things to be done. So apart from this, there are many other minor topics where the paper setters are frequently asking questions, and all these contents will be done in your activities as well as in the pro live classes and as well as in the offline sessions. So previously we never used to have a histopathology diagram based question, but now you can see this histopathology diagram based questions which are very common and familiar both in INICET as well as NEET. So it's mandatory that we have to do some or most of the histopathology is related to the head and neck, okay, and related to the lungs apart. So they're going to ask you very common questions, okay, cirrhosis of liver histopathology, hepatitis histopathology, lung carcinoma, that is squamous cell carcinoma histopathology, small cell carcinoma histopathology, adenocarcinoma of lung histopathology, amyloidosis histopathology, TB histopathology. So such very familiar things they are going to ask. They are not going to go the deeper contents which MBBS students did, because if it is in a preparation of general pathology for MBBS is so tricky, because you need to learn about the top to bottom from head and neck. So here we have to focus more on head and neck, and followed by all very important organs, followed by their most common diseases. Histopathology has to be done, and which we are going to provide a video in which we'll try to discuss all these histopathologies, and followed by I'm going to keep n number of exams so that you can exercise them. That is very, very important to identify the histopathology questions. And most of the histopathology questions, I know that most of you have done books like Harshamohan, which is very, very good book, but paper setters, they love to pick questions directly from Robinson. Okay, so whenever you want to read histopathology content, diagram based content specifically, rather than Harshamohan, I recommend you to go to Robinson, so that you will get least confused in the examination hall, because they love to pick questions from that particular area, whether it is NEET or INICT, because previous questions were directly taken from Robinson. So coming to the book of reference, as already discussed, Robbins is the book of reference for your general pathology. Okay, as most of us are reading, including me, we used to read from Harshamohan. There's nothing bad. Okay, you can keep, like, if you have your book with you, whenever you require any sort of reference or any sort of clarity, nothing wrong. You can go back to Harshamohan and you can refer and you can get back to the content. Okay, but I want you guys to stick on to the content of MDS CONQUER, because we tried our best, either the smart videos, or either the smart notes, or either the MCQs that we are planning to provide for this particular subject in a huge content. And followed by the pro-live students will have pro-live access, and offline students will have offline access. So basing upon your plan, okay, so try to focus and finish the checklist of checklists of contents for each topic of general pathology, and make sure you use the website and app in the most efficient way to finish these contents as fast as possible. Okay, I still see there are students who are not able to finish the contents within the time. They are not able to allocate proper time for the preparation. Okay, no need to write huge notes, because the video content or the smart notes content will be available on your app throughout your preparation phase. Okay, so there is no need to worry, and I don't want you to add heavy notes, heavy tables, heavy descriptive part, okay, heavy things on your notes. You simply write, for example, you are watching a video of calcifications, okay, different types of calcifications, or the difference between the calcifications. Okay, you don't need to write whatever that is there as a slide, or whatever that is there as a written content on the video to your notes. You simply write, okay, 5 minutes 35 seconds time zone in a particular video of cell injury, one table is there, I have to refer this table. You keep with a different color coding, okay, red color, I have to refer this table. You write this in the notes. Okay, few things you have to write, few things, tables, flow charts, lengthy things, or a descriptive part things. Okay, if you feel like your time is being congested, okay, because there are students from GDCs, okay, where they have heavy OP, or a private college having heavy OP, or the private college, whenever you are being posted in a departments like conservative, or departments like prosthetics, or departments like oral medicine, radiology, or oral surgery, definitely you will have a better OP. You will have better OP, or more than a double OP, when compared to departments like orthopedo, perio, or any other department. So whenever you're posted, you feel like, okay, I'm going behind the schedule, I'm not able to cope up with the schedule. In such cases, don't write heavy notes. Okay, the main concept of writing a notes is converting a short-term memory to long-term memory. So writing notes is not only the method where your short-term memory is going to convert into long-term memory. There are many other methods. Even if you read 5 times planned organized preparation, your short-term memory will be converted to long-term memory. But I see most of the interns and most of you, you're writing notes, but you're writing notes with a burden. So whenever you're writing notes with a burden, writing notes without satisfaction, your short-term memory will not convert into long-term memory. So the main goal of writing notes is to convert a short-term to long-term memory, which we are not able to reach. We are writing notes, but we are writing with lots of burden. So in such cases, you can follow these simple, smart things in your preparation so that you can achieve the goal of converting a short-term memory to long-term memory in less possible time. Because interns, few of you are working in the clinics, you have less time, so use the time in the most efficient way. Okay, let's use the time in the most smartest way and try to implement these suggestions which are given by me to your preparation, and you can see an extraordinary changes within a couple of days. Within a week or 5 days, you can see an extraordinary changes in your preparation. Okay, I hope now you got a basic idea about the general pathology. So even if you see the basic MCQ books that most of the dental students they read, so general pathology has an exclusive topic called as blood. Okay, so what they discuss in this blood, they discuss about the disorders of the RBC, disorders of the WBC, okay, RBC disorders, WBC disorders, and platelet disorders. So what are important in RBC disorders? The anemias are more important. WBC leukemias are more important. Okay, right? So all these contents, rather than doing in general pathology, they have to be done in combination with physio and medicine in the upcoming few months. Okay. So what I'm doing is we have excluded the blood disorders from general pathology. So whatever the pathological features, whatever the histopathological diagrams of these diseases are very important, which has to be done integrated with general medicine and physio. So I am excluding this blood disorders, okay, chapter from general pathology, because this chapter we are going to do along with physio and medicine. So apart from that chapter, I try to include each and every content related to the preparation in general pathology as of now. Okay, so don't come out and tell me, sir, this is not included, that is not included. Everything is included here. Okay, here. The reason is we go with an integrated mode of preparation. We don't go with a subject-wise mode of preparation. Of course, we ask you to do a particular subject at a particular time, but the main advantage of being a part of MDS CONQUER is whatever that is important will be done in common. We don't force you to do blood here, again doing blood in physio, again doing blood in medicine, again doing blood in different areas is going to keep a burden and your concepts will be diluted. So I will give a decent time for blood during physio and medicine, where pathology will be done along with the physio and medicine. But I'll make sure that you will be so strong in the concepts, so that if a question is coming in the final exam around these chapters, it will be very easy for you to handle. So love learning with Team MDS CONQUER. If you have any doubts or anything, we are always open to help you out. So this is the contact number of MDS CONQUER, which you can make it. Okay, so take care, all the best. And we'll be coming up with a few other updates on your respective groups. Thank you. Signing off, Dr. Shree from Team MDS CONQUER. Bye. Take care.